Now, some of you in this room may be thinking, I'm not doing mental health. I'm never ever going to work in mental health. Well, I guess what I want to say to you right now is you can't escape it. 2 in 5 of us in this room have already had a lived experience ourselves or with somebody very close to us that has been in mental distress or has a mental illness. Regardless of where you work, you are going to encounter people that experience mental distress and or have a mental illness. Nurses are integral to the provision of quality mental health care and should be competent in mental health care, exemplifying positive attitudes, behaviours, capability, experience, knowledge and skills in patient care, irrespective of their clinical specialty. It's never okay for us to talk about the myocardial infarction in bed 3, and it's never okay for us to talk about the schizophrenic that got admitted. It is always person first and disease second. That language should be across all spectrums of healthcare.